their cases, all right? Each case will have a 90-day period, all right, that they need to be reviewed in. They review it and they say, is it working, is it not working? Is this modality that we have chosen the appropriate modality? No, it isn't. Okay, change treatment plan. If we're getting nowhere, we changed the treatment plan. Okay, again, active, living, doable. All right, so that treatment isn't just, well, individual therapy is recommended. All right, for what? For how long? When is it no longer recommended? All right, for many years, I think the layman had the idea that individual treatment was the gold standard. Not necessarily. I have seen more good coming out of 12-week emotional regulation courses, all right, than I've seen some people with years and years and years of individual therapy. Okay. Does anybody know what emotional regulation courses are? Okay. 12 weeks, first 4 weeks, all right, you teach the person how to deal with their own emotional behavior. Okay, to recognize what they're feeling and how they're acting out and how to do things differently. They don't talk very much. We teach them. Okay, they can ask questions, but we're not listening to their particular problem. The next 4 weeks, we teach them how to engage with quote unquote other normal people. Okay? The last 4 weeks, we teach them how to deal with quote unquote difficult people. We've used this for psychotic individuals. We've used this for depressed individuals. We've used this for individuals involved in domestic relations problems. Okay? It's across the board because we're looking at skill deficits. All right? People don't know how to do. Before you diagnose, make sure there is not a lack of information. And it has always amazed me, all right, how much more gets done when you basically say, you don't know how to do it? Let me give you some ideas on how to do it. Okay? That's what the treatment plan would indicate. So again, the interventions can change every 3 months. We can get to know you, we can get to stabilize you, we can get the family in individual therapy. All right? Then we move into, you need some skill building. Okay? Then we can move into a group where it's a laboratory for what you've learned. We're going to put you in with people who are likely to arouse the kind of problems that you've dealt with outside. Now you take those skills that you just spent the last 12 weeks in learning and apply it in this situation. Okay? It's another one of my pet bugaboo, group therapy. If an individual does not know what they're supposed to do differently in group therapy, don't send them to group therapy. They're not going to learn anything. It's going to become a complaint fest. All right? They will sit there and tell stories and so forth. And where's the change occur? Group needs to be a laboratory for skills that you're attempting to integrate into yourself. Okay? Now, I can't tell you how difficult this middle part is. I've kind of joked about it a little bit, but if you take a look at some of the people that you've dealt with, I'm assuming that there is a variety of experience with CASA in this group. Is everybody new, or have some people been? You're new. You're not new? New? No. Not new. All right, two. All right. And in this group, is there a new person, old person? Who's the senior member there? Are you the senior member there? Okay.
There are different levels.
Different levels. Okay. What I want you to do is I want the senior person, all right, in the group to talk about a recent case. I want you to talk amongst yourself. Okay. I'd like for you now to pick one person out of your little group, all right? Not the person who told about the case. but someone who thinks they really heard everything. You can identify yourself to your group members, and what I'd like for that person to tell me is what the problem was. What's the behavior problem that you would like to see changed?
Well, in the scenario we had in our case, I think the case problem was two alcoholic parents that basically, if I heard it correctly, the father really didn't care at all for anything that happened with the family. The mother did go through treatment, but she just went through the facade of treatment.
Okay.
And went back to her old habits. The children were given to maternal grandparents?
Grandmother.
And
Okay.
this caused elevated stress levels in the grandparents.
Uh-huh.
And it was brought to the CASA's attention that possibly the grandparent could benefit from maybe some stress management and things of that nature.
Okay.
But that never came to fruition.
Okay.
Eventually, the end of the story is the children are with the grandparents.
All right. And so the children are with the grandparents. All right.
I guess that's the problem. The goal was hopefully to have permanent placement with the parents,
Okay.
but because of the problems,
It never, okay. So the problem you're stuck with now, all right, is you have stressed out grandparents, right?
Correct.
Okay. Stressed out GPs, okay. How does it demonstrate itself?
I'm lost here as far as,
How do we know the grandparents are stressed out?
yeah, I don't
We didn't
think,
get to that.
yeah.
Okay, do you know how we can tell the grandparents are stressed out?
I know how I interpreted it.
Go ahead. Okay.
I saw that they were time management problems that they were definitely running into. I could see that the children were getting on their nerves. They felt that grandparents should be able to have kids for a little while to be able to give them back to the parents to do all the other things. They were having to be disciplinarianism when they weren't. They didn't feel that was a role of a grandparent. For the routine things that were going on. I mean,
So the grandparents really didn't want the kids, is that?
They would keep them because they didn't want to see them go into foster home. But
Okay.
that was the only reason they would keep them.
Okay, now, is there hesitancy to keep the children, all right, a result of their being stressed out by the day-to-day parenting that's been put back on them?
Partially, I thought, and the other part was I think they were using it as a tool to get their daughter to really get treatment and benefit from treatment.
Okay, that they were willing to take on the children if the daughter would get herself straight.
So they could give them back, right? But
So
they
they
really
could-
didn't want the children
okay.
long term.
Okay, okay. So, all right, so the problem here is that we have a temporary housing situation for these children, okay, and that basically the mother is not making the changes needed to return them to her.
Correct.
Okay, would that be a
Yes.
good way of, okay. All right, so stressed out grandparents is really not the problem, all right? The problem is mother not changing. Okay. So we're looking here for behavior change. So I'm going to just put this down. Now, whether it's possible or not is another issue, all right? But goal is behavior change. What specifically needs to change? What does the mother need to do differently?
Stop drinking, recognize she's an alcoholic.
Okay, mother will,
So decide that she can stick with one man.
mother will stop drinking. Mother, we won't say we'll be celibate, but let's be choosier. Okay. We'll be more monogamous, all right?
Get a life together,
Okay. What else?
Those two would probably fix a lot.
Okay, those two.
Anyone, the stable job, that would come, the drinking was part of the problem, she'd have a stable job.
Mother will have stable job.
Where's the father? Where's the father? I keep hearing you say the mother.
Oh, the father just sort of, okay, yeah, I'm happy drinking, I don't wanna go to treatment, I'm gonna let the drinking kill me. I mean, he was literally hospitalized and came close to death a couple of times, and he didn't care about anything else.
Okay, now, you see what we've done here. Okay, we kind of got down to where is the change got to happen, and what kind of change? Is it just a question of stabilizing the situation? Is it a relapse? No, what we're going here for is behavior change, all right? But it isn't the grandparents, all right? It's really the mother, right? And so what?
If you're looking at the goal of return to parents, correct?
Yes, okay. And then we've specified now the behaviors, all right, that would allow for reunification of this family. Okay, whose care is mother in? Is she in anybody's care? Is she under her own? Is she under court order? Is she?
She had a court order to go to classes and follow recommendations. She went to class or followed her short-term treatment, wouldn't follow recommendations. Been in jail a couple times for fights between boyfriends and or husbands or boyfriends.
Okay. Does the mother have a case manager?
Not that I know of.
Is she in the mental health system?
She refused to go.
She refused to go.
She was ordered, but she refused.
She's okay. What leverage does the court have over her at this point?
She wants her kids back if she has to follow those rules.
And Linda's saying something in the background there. What's that, Linda?
Oh, she wants the children.
That's what I just said. That's what I just said. That's the only thing the court can do.
It's the only It's the only thing that can do here. And
You don't want your kids back? Don't do any of these things and they stay away from you. No
Okay.
visitations, etc.
okay, is she agitating to have the children back, or?
She says she does, but her behavior didn't indicate that.
Okay. Okay. So the likelihood of without these changes occurring, she goes back to court and the judge will say, no go. You can't have these children back.
Correct.
Okay. What happens to the children then?
Stay with grandparents as long as the grandparents are willing to keep them. If the grandparents don't want them, they tell the social worker, then they go into foster care.
Okay. You've met the grandparents.
Yes.
Do the grandparents want them?
Yes and no.
Okay. What would enable the grandparents to keep them? What supports do the grandparents need? What education do the grandparents need? In other words, what objectives, all right, what changes in the grandparents' life would need to occur in order to make this feasible for the grandparents?
They need to stop enabling their daughter, which they were doing things which everybody seemed to think was enabling her to have this, what I'll call, not best behavior for
Okay.
the children.
Let me make a jump here. I'm assuming that the daughter being enabled and so forth, okay, would tell me as a clinician that the grandparents perhaps need some help in parenting all the way around.
I wouldn't argue with that.
Okay, not just with the kids, but also with the mother.
I wouldn't argue with that.
Okay. So it would seem to me that what would enable this situation to go on, hello there, would be to increase grandparents' abilities to set limits, right? To have a clear understanding of who is responsible for what, all right? And to convey this in a clear manner to their daughter.
Okay.
Okay? In other words, that word enabling triggered something here in me, which is basically saying, even if these grandparents get the daughter, out to a different country, all right, they still haven't learned certain skills, which will be conveyed to these children, another point. So whether the daughter stays in the picture or whether the daughter doesn't stay in the picture, we have these kids with these grandparents right now. And so I would explain that to them, all right? I mean, this, if you talk to them, I would say, look, you know, you have a situation with your daughter that looks like this. Here are the options. The court is not going to give them back, all right, to her the way she's behaving. I could totally appreciate and understand the situation you're in, all right? And if we could help you do this, this, and this, do you think that could take some of the stress off of you? Okay? It could also be that they need respite care. You know, they could need organizational backup of some sort, all right? But if they would agree with those 3 things that I just gave you there, then you can start taking a look at what interventions might be able to get them there. First thing that comes to my head might be to refer them to a step parenting group. You know what step parenting is, right? Okay, very clear, you know, whose responsibility, whose problem, you know, how to deal, you know. That might take some stress off of them. Respite care, if they had some situation where they could get a break from themselves, especially if the kids are little ones, you know, good, dependable care where they could say, hey, we need a day to ourselves. Can the system help me connect with, you know, something like that? Be it a SAC program, you know, whatever is available. So once you got where the problem rests, all right, and we could easily look at the mother and say she's the problem. Well, the reality is right now, here's the situation we have to deal with. The grandparents are stuck there by choice or by circumstances. What can be put into action, all right, to, number one, stabilize the situation so these grandparents don't feel like they're in crisis. But number two, offer them some skill building, you know, or something that at least for the near future, all right, they're not enabling their daughter to continue along this path, and they're also providing different type of parenting to the grandchildren. Okay? Now, is this your job? No. Okay? Not at all. But if you're talking to the social worker who talks to the other people, you might say, hey, you know, these are some of the ideas I had. Do with it as you wish, but I'm going to give you my ideas. You have a point to start with, all right? And very honestly, you can trigger some other professional people's thinking. The important thing is to locate where the problem is right now, all right? Not in the past, not in the future, but right now. And if there were some changes that could be made, that you could say, you know, honestly, if the parents would stop enabling that daughter, I really think this could be made different. And let's think about what can be given to these grandparents, all right, to help them achieve that objective. Okay? It's not a perfect solution, but at least it gets you thinking in a, what shall we say, systemized way. Okay? When you have that form in front of you, you can start to say, okay, what am I aiming for? What would it look like? And now let's talk about possible interventions. Okay?
And then you have the court steps in the middle of it and says, and the social workers say, we're backing out of this, it's been going on a year and a half.
Yeah.
No progress is being made to return the children home.
Mm-hmm.
You know, they went to a status hearing and they said,
And it's
okay,
very frustrating.
yeah,
Very
that's
frustrating.
They backed out of it.
Right.
We had to
Okay.
back out of it. You know.
I'm going to go back to Latin again. All right? All right. You know, we all kind of see the Japanese in the sense of honor, all right? And if they feel dishonored, they fall upon their swords or stuff like that. Well, that was also part of the Roman tradition, all right? That if a general did not conduct himself in an honorable way, all right, he was to fall on a sword because he had lost his dignity, all right? And a dignity didn't have to do with whether you lost a battle or you won the battle. It had to do with how the general conducted himself, all right? Because the Roman thought was, with dignity, you have authority. A Roman senator with dignity could walk through a group of barbarians and they would make way for him, right? I remember this, and it really makes a difference because one of my objectives with my clients is to return their dignity to them. I think that's extremely, extremely important. To me, dignity means you look in the mirror and you can honestly say, regardless of the outcome, all right, regardless of whether my words are heard or not heard, I in myself, all right, can look myself in the mirror and say, I did the very best that was humanly possible in that situation. Okay. That's probably the only antidote to that kind of frustration. All right, that you know within yourself, because you're here as volunteers. You're not here to being paid. Nobody's noticing. You notice. You know that you want to make a difference and that you're going to do the very best you possibly can. What I would say to you folks is maintain your dignity. If you believe in something, you believe in doing it right, do it in the very best possible way that you can do it, and know that you've done that. Because all of this work, we're dealing with people we really don't have control over. I'm not kidding when I'm saying 13% are treatment cases. The rest of them, we had to watch them go knowing full well that they were likely to repeat or likely to get back into a mess or likely to relapse or likely get off their medications, and we would have this whole thing going on over and over and over. Burnout is part of the name of the game here, all right? Sometimes you need to take a break and say, I can't do anymore, all right? And you got to be honest with yourself on that. But the important thing is hold on to your dignity. And dignity has to do with you really have to deal with yourself in terms of I've given it my best input. Doesn't do much for the frustration, but there you go.
Such a
Yeah,
life.
that is life, yeah.
Dealing with CASA work
Yes, yes it is.
in the courts.
Okay, but thank you for sharing that, I really do. You have something you want to bring up? You had a case that you folks wanted to talk about?
We spoke about his case. The mom, I guess, has been diagnosed with bipolar and borderline.
Mm-hmm.
So abusing her medications, also abusing marijuana. Also sexually abused her 3-year-old.
She sexually abused her 3-year-old.
And she agreed to terminate her parental rights, but is now appealing that process. The child is living with the grandparents. I guess the mom has been pretty resistant to all the court-ordered type treatments until very recently.
Mm-hmm. Something has changed recently?
She basically wants to make herself into Mother Teresa now.
Okay. Is she able to talk about what it is she would have to change about herself to become Mother Teresa?
She is in total denial of any sexual abuse, but the findings are so overwhelming. The polygraphs are inconclusive because of the medication and the abuse of medications during the tests.
Mm-hmm.
But and I think she feels that the longer she drags out the proceedings,